Hi, everyone. We'll be getting started in a few minutes. Hi, everyone. I'm Ken with Ken's Insurance Agency. We're a full insurance brokerage. We're coming to you tonight to talk to you about Medicare, and it's very fitting that we're talking to you about Medicare tonight. The reason why is, as of today, open enrollment for Medicare has started. So we can now enroll you for Medicare for 2020. So please feel free to give us a call or comment below healthcare, or you can also PM us if you're seeing this on our social media page, and we'll be glad to get you an appointment scheduled. Now let's talk about Medicare for a second. And we're going to share the screen to where you can see our presentation. So Medicare, you have different parts that Medicare consists of: Part A, Part B, Part C, a supplement, and Part D. We'll go over these in more detail in a minute. Medicare is health care for certain disabled people and for seniors. Open enrollment, as I said, is from October 15th through December 7th. There is a 7-month period around your birthday, which starts 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday that you can enroll. There's other special enrollment periods, like receiving Medicaid, moving into a long-term care or special needs facility, or having a chronic condition, or even moving outside of your coverage area into a new coverage area. You can face penalties if you do not sign up for Medicare Parts A, B, and D around your 65th birthday, and if you let the coverage lapse. Every year at open enrollment, your plan must be reviewed and updated accordingly. Medicare Part A covers inpatient hospital care, skilled nursing facility care, long-term care hospitals. Most people don't pay a premium for Part A. If you buy Part A, you'll pay up to $422 each month. If you paid Medicare taxes for less than 30 quarters, the standard Part A premium is $422. If you paid Medicare taxes for 30 quarters to 39 quarters, the standard Part A premium is $232. Oh, excuse me. You pay $1,340 deductible each benefit period. A benefit period is every 90 days. Days 1 through 60 is $0 coinsurance for each benefit period after the deductible is met. Day 61 through 90 is $335 coinsurance per day of each benefit period. Days 91 and beyond is $670 coinsurance for each lifetime reserve day after 90 days for each benefit period, up to 60 days over your lifetime. Beyond lifetime reserve days, all cost. So once you've used up your lifetime reserve days, then basically anything after 90 days, you pay all the cost. Part B covers two types of services: medically necessary services. Services are supplies that are needed to diagnose or treat your medical condition that meet accepted standards of medical practice. And preventative services such as healthcare to prevent illness like the flu are detected at an early stage when treatment is most likely to work best. You pay nothing for most preventative services if you get the service from a healthcare provider who accepts assignment. Part B also covers clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, getting a second opinion before surgery, limited outpatient prescription drugs. Most of your prescription drugs are going to be covered by Part D. Two ways to find out. Let's skip that. The standard Part B premium is $134 or higher depending on your income. However, some people who get Social Security benefits will pay less than this amount, $130 on average. You also have $183 per year deductible, and then after that, you pay a 20% coinsurance. Medicare Part C, otherwise known as Medicare Advantage, in some areas it's also known as Medicare Select, is a plan that will cover your medical and doctor. It's provided by private insurance companies, must have Part A and B, usually includes Part D. It's very affordable price, has deductibles, copays, and coinsurances. Usually comes with extras like the ability for a free gym membership, hearing, vision, and dental. Medicare supplements, a way to pay for your out-of-pocket expenses, must have Part A and B, cannot have Medicare Part C. Part D sold separately is more expensive than Part C, broken into different versions, A, B, C, F high deductible, G, M, and N. And at this year's end, you'll no longer be able to get C, F high deductible. There will become a G high deductible also. Can have a deductible on copays and coinsurances. Usually does not have extra services like hearing, vision, dental, and does not come with a free gym membership usually. Prescription drug coverage is your Part D or PDP. Provided by private insurance companies, must have Part A and or Part B. Can be part of a Medicare Advantage Part C or sold with a supplement. If you have a Medicare Advantage, you must buy it with the Part D that is included in the plan. Medicare Part D is broken up as a formulary. The formulary is broken up into tiers, and the tiers determine the cost of the drugs. Lower tier will generally cost you less than a higher tier. A Medicare drug plan can make some changes to its formulary during the year within guidelines set by Medicare. If the changes involves a drug you're currently taking, your plan must do one of these: provide written notice to you at least 60 days prior to the date the change becomes effective. At the time you request a refill, provide both of these: a written notice of change and a 60-day supply of the drug under the same plan rules as before the change. What you'll pay with your Medicare drug plan: you'll have a premium, a yearly deductible, co-pays and co-insurances, cost in the coverage gap, cost if you get extra help, cost if you pay a late enrollment penalty. And these all vary depending on the plan you choose and the drugs you use and the pharmacy network and the formulary, and whether you get extra help or not. You can also get supplements to go along with Medicare, like a cancer, critical illness, hospital indemnity, or a Medicare Gap plan. Something else that we would like to show you that you can get that would be very helpful and all would be this. And we're only going to show you the health parts, as it would be the main parts that we can show.
Our Real Money team is back, saving you a lot of money on your doctor bill. Americans, on average, spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service. Hi. But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money to take off from work, to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctor's office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
Well, it'd be $100 just to tell me that I got the poison ivy that I know I have.
Taking a picture.
I have the picture.
Uploading it and answering a few questions. An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits. In all, Phil's bill was about half of what it usually costs him to visit the doctor's office, and Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money!
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. The prescription was sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience with Teladoc doctors, 15 years. Average time it takes to get a call back from a Teladoc doctor for the quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle. All right.
3.
Exclusive.
Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
You know, it wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi, thanks for seeing me. I'm glad you scheduled some time. How can I help? Make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle needs a dragon. Huh? Darn.
They're finally asleep. How are you?
I'm good. I think we're gonna be all right.
So that shows you what we can show you with this plan, but there's so much more that's included with it, and you're only paying $49 a month and a one-time enrollment fee of $49 for this. If you get a Medicare Advantage plan, you're looking at a $0 to $99 monthly premium. The Medicare Advantage can be deducted from your Social Security or your railroad check. Let's see here. If you get a supplement, you'll have to pay for that out of your checking account. Usually, Part D can be deducted from your Social Security or railroad check if you have to buy it separately. So these can be very affordable options. We look forward to helping you. Give us a call, 662-912-3914. Again, that number is 662-912-3914. Or you can PM us on Facebook, either by looking up Kenneth Sigler, which will be tagged in this post, or you can, and it'll be on our pages. So you'll be able to go and PM us off of those pages. You can also PM us on our agency, or even go to our agency site and try to schedule an appointment. We have a booking system there on our agency Facebook page. You can also go to our website, which is on our agency web page, and schedule an appointment. We look forward to helping you. Get in touch with us, both for your Medicare needs before Medicare open enrollment ends, and for all your ACA needs before ACA open enrollment ends, which will begin November 1st and go through December 15th. Thank you and have a nice day.